Today we will learn about the clinical classification of diseases. Dr. Hahnemann has studied the nosological classification and after that he has criticized the same. And he has not criticized the nosological classification straight away. He has studied the nosological classification from each and every viewpoint. He has studied the febrile and afebrile diseases. He has studied the epidemics diseases. He was not convinced with the nosological classification. That is why he has opposed the nosological classification of the disease. And we know that he has came to the conclusion regarding the causes of the illness in the 4th edition of Organon of Medicine. And after knowing the causes of the illness, he has evolved up to the 5th edition of Organon of Medicine, in which he has given the clinical classification of the diseases. This clinical classification of the disease is mainly based on the schema of etiological considerations, means it is based on the consideration according to the causes which are producing or which are responsible for the production of the various kind of diseases. According to clinical classification of diseases, illness means deviation from a state of complete physical, mental and social well-being. This deviation from the former healthy state has occurred due to certain kind of causes. And according to these causes, Dr. Hahnemann has classified this illness into 3 major parts. One is indisposition, second is surgical diseases, and the third is dynamic disease or disease proper. Now see the genius of Dr. Hahnemann, that he has given the major classification of the diseases as according to the altered physiology, altered anatomy and pathology. So he has travelled from altered physiology to pathology very easily. Now we will learn what is indisposition. Indisposition means a slight alteration in state of health manifested by one or more trivial symptom. This indisposition is only a slight alteration. I again repeat, a slight alteration in the state of health. And if we go to refer the definition of health, that it is a perfect equilibrium between soul, mind and body to perform the higher function of our life. That do we mean by health. And the slight alteration in the state of health which will manifest by one or more slightest symptoms. And that is why this is known to be a slight alteration in normal physiology. This alteration in the physiology is due to any kind of overstrain or overexertion or overaction in any direction. And this indisposition can be corrected by a slight alteration in the diet and regimen. For indisposition, we never require any kind of medicine, because here the vital force has not deranged, but the state of health has slightly altered, which can be corrected by the slightest changes in the diet and regimen, so that again the normal physiology will established and there will be a perfect equilibrium between soul, mind and body. After defining the indisposition, Dr. Hahnemann has classified and explained the surgical diseases. These diseases occur due to injuries to the body from without, means that the cause of injury is from outside. The injury has not occurred from the within or from the vital force. Here the vital force is not deranged, but some outside injury has been made to the body, and that is why the body is suffering from certain kind of diseases. In such type of diseases, the mechanical aid, or we can say support to the affected part, is required. If we take the example of fractured bone due to an accident or any kind of fall or any kind of injury, in such kind of cases, these diseases are known as surgical diseases, where the mechanical aid is required to support, to reform the union of the bone. If you can remember the obstacle to cure, then you can recollect it, that mechanical aid should be provided by the physician, and then he can administer the proper homeopathic remedy to initiate the healing process, which comes from within or which starts from the within. But before that, the mechanical aid should be provided to the affected part to start the healing process as early as possible. Apart from indisposition and the surgical diseases occurring from without, he has divided all the dynamic disease into two main categories, that is acute and chronic diseases, with special meaning to each, and he has divided the chronic diseases according to the etiology under three miasmatic maladies. That is what we know: sora, psychosis and syphilis. If we refer the etiological factors, the acute diseases are due to the exciting causes, whereas chronic diseases are due to the fundamental causes, which we know as prima causa morbi, the most primary or fundamental cause of the illness. Now we will learn about the dynamic disease or disease proper. In this type of diseases, the vital principle get deranged such an extent that it produces the alteration in sensation and functions, and it may terminate into the ultimate structural changes. This alteration in sensation and functions of affected parts are exposed to the senses of the observer and the physician, because they express themselves through the perceptible sign and symptoms, and that perceptible sign and symptoms are the true expression of the internally deranged vital principle. According to the concept of causative factors, Dr. Hahnemann has subdivided the dynamic disease into two main categories. These categories are: one is acute diseases and the another is chronic diseases. Now we will learn regarding acute diseases in detail. These acute diseases are those diseases whose onset is sudden and violent. They are having short duration, and they will terminate either in complete cure or will terminate into the death. I am saying that they can terminate into the complete cure with or without medicine, because we know that the person who is skilled in the art of diagnosis of the disease, the art of prognosis of the disease, and who knows that the body itself has a curative properties, because the life governing force is also working as a preservative power, or the vital force has a self preserving quality, he can rely upon that particular power of self preservation, and unless and until this power is comparatively more disturbed of the morbific agent, he can give medicine in such type of cases. But in the many cases, he can rely upon that self-preservative power without any kind of medication. These acute diseases are due to the transient explosion of the latent sora, and this transient explosion of latent sora is because of the exciting causes. The acute diseases are mainly of three types. One is individual acute diseases, second the sporadic acute diseases, and the third one is epidemic acute diseases. The individual acute disease, they are the instances of transient explosion of latent sora, and this transient explosion of latent sora is because of excess in food or insufficient supply of food, or we can say there will be a severe physical impression like chill, overstrain, mental emotional strains. Then comes the sporadic acute diseases. The diseases attacking sporadically. As for example, the diseases that attack several persons at the same time here and there. They are scattered. The individual or the localities where they are existed are the scattered localities. And then comes the epidemic diseases. These epidemic diseases are due to some general climatic conditions like war, famine, etc., overpowering the resistance of a mass of people in same locality. Here we can differentiate this epidemic disease from a sporadic disease. Sporadic disease occur in a scattered here and there way. An epidemic disease is concentrated in a one locality or in a same locality. Or this epidemic disease can occur due to infection with some violent fixed miasms. After defining the acute diseases and its types, Dr. Hahnemann has stated regarding the chronic diseases. The onset of this chronic disease is gradual. They have a long duration and ultimately they will terminate into the death. And especially if not treated properly, it will definitely terminate into the death of the patient. These chronic diseases manifest themselves through the perceptible sign and symptoms. And according to their manifestation of perceptible sign and symptoms and their quality and the quantity of this perceptible sign and symptoms, Dr. Hahnemann has further divided this chronic disease into two main categories. The first one is the diseases which manifest with the few symptoms, and the diseases which manifest themselves with fully developed symptoms. Now try to understand what is the meaning of diseases with few symptoms. It does not mean that we makes mistake in the case taking of the case and we get only few symptoms. But Dr. Hahnemann wants to guide us that even after a skilled interrogation or skilled case taking, we only get few symptoms which are perceptible to our senses. And the diseases which are having fully developed symptoms means those diseases that after skilled interrogations we get the full picture of the disease in the form of quantity of perceptible sign and symptoms. Here the general symptoms, the particular symptoms, the characteristic symptoms, the alternating symptoms, and all kind of symptomatology is available to the perceiving physician. The diseases which manifest themselves through few symptoms have further divided into two main categories. The first one is the one-sided diseases and the second one is the local diseases. This both kind of category are again divided into two main other categories, or the, they subdivided into two categories. These are the diseases with only mental symptom and diseases with only physical symptoms. These are the category of one-sided disease, and the surgical diseases and non-surgical diseases are the category of local diseases. This one-sided disease again divide into two, that is diseases with only mental symptom or diseases with only mental symptoms, and the examples are insanity, schizophrenia or generalized anxiety disorders, and diseases with only physical symptoms such as all kind of disabilities available in the patient, though they are mentally free from any kind of diseases. The local diseases are divided into two categories, that are the surgical diseases as well as non-surgical diseases. The surgical diseases are those diseases which have their cause from within. The classification of the disease is start with the indisposition, surgical diseases and dynamic disease proper. Here in the topmost classification, the surgical disease means the diseases which originates from without, and here we are saying that the surgical diseases which originates themselves from within, so the cause is within the organism. This kind of surgical diseases are due to the any pathological changes, and especially the irreversible pathological changes which is known as limitations of homeopathic medication, as well as they fall into the domain of surgery. And the non-surgical diseases, these non-surgical diseases are those in which the pathology remains at a reversible level, and this reversible pathological structural changes can be cured with the homeopathic medication. That is why in homeopathy this type of surgical diseases are known to be the non-surgical disease. Now we have came to the diseases which manifest themselves through the fully developed symptoms or symptomatology. This diseases which express themselves through developed symptomatology can be divided into two main categories. The one is the non-miasmatic chronic disease and the other is the miasmatic chronic disease. This non-miasmatic chronic disease and miasmatic chronic disease has labeled because of their causative factors. In non-miasmatic chronic disease, there is a no single miasm is working or the responsible for the development of such kind of diseases. And in miasmatic chronic disease, the responsible factor behind developing the whole chronic diseases is miasm or miasms. It may be a single miasm, it may be a more than one miasm. In non-miasmatic chronic disease, if we want to study, we have to study the various kind of causative factors which can produce the non-miasmatic chronic disease. The first factor which can produce the non-miasmatic chronic disease is bad hygienic conditions or bad kind of living conditions. Suppose a person who is living in a damp place, naturally he is going to suffer from joint pain or any kind of respiratory complaint or other kind of skin complaints because of the humidity and dampness of that particular living conditions. And if we want to cure such kind of disease, we just have to shift that particular person to a dry and healthy living place. And if we can shift him to a dry place with ventilation has been provided adequately, we can cure such kind of conditions without any kind of medication. The other type is the occupational diseases. we will going to refer the preventive and social medicine that pneumoconiosis are a type of certain kind of diseases. These occupational diseases are because of the particular kind of occupation. There are certain diseases which occur due to the silicosis in asbestos factory or silica factories. There are other types of poisoning or chronic poisoning in the factory of fertilizers and the chemical factories. This all kind suggests that these are the occupational diseases, and once this occupation has been changed, the person will not suffer from such kind of complaint. And the last but not the least, that comes because this kind of diseases are due to continued treatment with the non-homeopathic drugs in crude forms. Here we have to understand that what Dr. Hahnemann means for non-homeopathic drugs. He means that non-homeopathic drug means any drug which is not having particular homeopathic relations to the case, that is, it is not similar to the case, because the fundamental law of homeopathy is similia similibus curantur, and any drug which is not based on such kind of law are considered to be the non-homeopathic remedies, and when such kind of remedies are given for a longer period of time in crude form, they always produce certain kind of diseases. Even homeopathic drugs which are not similar to the case are non-homeopathic to the case, and that we have to understand with our head and with our heart. And whenever such kind of medication has been given, it will definitely produce certain kind of diseases which are most difficult to cure as well as the most harmful to the patient's vital strength. Now we are coming to the miasmatic chronic disease, for which the singular or multiple miasms are responsible. And according to the single miasm and the multiple miasms, this divide into main two parts, that is single miasmatic disease and compound miasmatic diseases. In single miasmatic disease, either the sora is responsible, either the psychosis is responsible, or either the syphilis is responsible. But in compound miasmatic diseases, either there will be a combination of sora and psychosis, psychosis and syphilis, syphilis and sora, or all the three all together. This forms the compound miasmatic disease, and that is why this is the most difficult to cure such kind of compound miasmatic